John Swinney on treating the Coronavirus Extension and Expiry Scotland Bill as an emergency bill, and any member who wishes to speak against the motion should press their Request to Speak button now. And I call on George Adam to speak to and move the motion.
Can I move the motion and speak to the motion as well, Presiding Officer? Basically, over the past, as you'll agree, over the past number of weeks, I've tried to be reasonable in my work that I've done with colleagues on the Bureau, but sometimes reason can only be one-sided. But as I've previously explained to other members of the Bureau, the Coronavirus Extension Expiry Scotland Bill was introduced on the 18th of June, and having a stage a day from the 22nd to the 24th of June to maximise scrutiny time. This obviously is a change from the previous versions of the bill previously, where it was done over one day. Now, that would mean stage 1 would be today, stage 2 tomorrow and stage 3 Thursday. In order to create further flexibility, the Bureau agreed to 6:30 decision times on both Tuesdays, Wednesdays and Thursdays. And I believe the passage of this bill is not too difficult for those to understand. If we do not pass the bill before summer recess, there will be significant less time for citizens, and public authorities will have significant less time to respond to the changes before they come into effect at September. Also, if we take into account the time needed for royal assent, if the bill is not introduced and passed by the end of June, we run the very serious risks of the provisions expiring on the 30th of September and temporary measures which are enabling public authorities to continue to operate in the pandemic falling away.
Colleagues, we will hear the Minister. Thank you.
As I have said countless times previously, this bill does not introduce any new provisions. It merely removes temporary measures that are no longer necessary or extends the expiry date to March 2022 to ensure that public bodies can continue to operate while public health measures remain in place. Officials have engaged with stakeholders in the ongoing use of the temporary measures throughout the reporting periods, and they have also engaged on an informal basis with stakeholders when considering when temporary measures should be extended or expired. Presiding Officer, I think it is obviously clear why we must progress with this bill this week. To leave everything else to chance, as others would propose, would not be a prudent way forward. So I put the motion forward to the Chamber.
Thank you. I call on Stephen Kerr.
Presiding Officer, this bill should not be treated as an emergency bill. Emergency implies that we need a sense of urgency, and to go against established processes of consultation and parliamentary scrutiny. However, we do not have such a sense of urgency, as the powers granted by the Coronavirus Scotland Act do not run out until the 30th of September 2021. So instead of steamrolling through this bill in a few short hours over the next 3 days, the Government should use the summer recess to consult more widely on the proposed extension to the emergency provisions. The summer recess should also be used to see how COVID develops. Thanks to the UK Government's vaccine procurement and the tireless work of NHS staff and volunteers throughout the UK, more people are developing immunity each day. All the data is telling us that the vaccines are highly effective against all the known variants. In the weeks and months ahead, the rate of immunity will continue to increase as the vaccine is continued to be rolled out at an accelerated rate of progress. This will hopefully see the rate of transmission and the number of people requiring hospitalisation decline. If it does, then the situation we are in as we return from recess will be more optimistic, as these powers will run on until at least March 2022, it would only be appropriate for this Parliament to debate and vote on an extension of these emergency powers after the Government has held a proper consultation and we have seen the impact of the continued vaccination rollout over the summer.
Thank you. I call Alex Cole-Hamilton. Briefly, please.
Thank you, Presiding Officer. It will be brief. I had not intended to rise in this debate, but as the Minister wouldn't take my intervention, I feel compelled to speak now. This is a piece of legislation that empowers the executive branch of government, once again, to an unprecedented level. But we are asked, as a legislature, to pass this bill in 3 days for a landscape of the virus that we won't understand for many weeks to come. We're being asked to empower this government with a set of powers that will come into force towards the end of this year and then turn into the next year. This is a level of power that in any other circumstance no other party in this Parliament would endorse or support, and as such I cannot support the timetabling of this bill as it stands.
Thank you. I call on the Minister to respond.
Thank you, Presiding Officer. As I have said to the members previously, we've tried to be reasonable in putting this forward. We still live in extremely difficult times. There is still a pandemic happening in Scotland as we speak. To not actually have these powers in place at this stage would actually put things at risk, and would actually, the idea of putting your hands in your pockets and looking to see what happens over the next couple of months is not a way forward as far as I'm concerned. So, in closing, Presiding Officer, I would say that we need to go through with, as we've said, over the next 3 days. There is opportunity for those to actually involve in the process and to ensure that we can make sure that we have the bill that we all want to put forward.
Thank you. The question is that motion 447, in the name of John Swinney, on the Coronavirus Extension and Expiry Scotland Bill, be agreed. Are we all agreed? Yes. The Parliament is not agreed, therefore we will move to a vote. We'll have a short technical suspension. closed. The result of the vote on motion 447 in the name of John Swinney is yes 87, no 31. There were no abstentions. The motion is therefore agreed. The next item of business is consideration of business motion 397 in the name of George Adam on behalf of the Parliamentary Bureau setting out the timetable for a bill. Any member who wishes to speak against the motion should press their request to speak button now. And I call on George Adam to move the motion.
Formally moved, Presiding Officer.
Thank you. I call on Stephen Kerr.
Presiding Officer, there is absolutely no case for bypassing due process, and the laws as they stand do not need to be renewed. They do not need to be pushed, steamrolled through this Parliament in just a few hours, because the provisions of the Acts do not expire until the very last day of September. There should be proper consultation, and Parliament should have adequate time to scrutinise this bill. We oppose this motion.
Thank you. I call on the Minister to respond.
Thank you, Presiding Officer. I feel as if I'm in Groundhog Day here at the moment, but just to go through the process again, this has been discussed at length at Bureau. We discussed the whole process. We discussed how we would take this bill forward, and for Mr Kerr to come here and say it's been bounced through and rushed through is just complete and utter nonsense. And really we're wasting time that we could actually be using to actually discuss the matter itself, which is more important to the people of Scotland.
Thank you. The question is that motion 397 be agreed. Are we all agreed? No. Parliament is not agreed. Members should cast their votes now. The result of the vote on motion 397 in the name of George Adam on behalf of the Parliamentary Bureau is yes 85, no 31. There were no abstentions. The motion is therefore agreed. Before I move on to the next item of business, I wish to make a short statement. Concerns have been raised regarding the use of a government-initiated question to announce the additions of Manchester and Salford to the list of areas where common travel restrictions apply. I understand this mechanism has been used on earlier occasions to make such announcements. Notably, in this case, the announcement was made by GIQ on Thursday, the 17th of June, a sitting day when there may have been an opportunity for members to scrutinise the decision in the Chamber. I would therefore ask the Minister for Parliamentary Business to reflect on whether GIQs are an appropriate method to use for these announcements on days when Parliament is sitting. In the meantime, I have selected a topical question on the issue to allow members to ask questions on the decision in the Chamber at the earliest opportunity. And we will now move to topical questions. And question. Point of order, Stephen Kerr.
Can I welcome the announcement you've just made, the statement you've just made in relation to the respect that this Parliament is due from the Scottish Government. It was on Tuesday, June the 8th, that I first raised a point of order with you in which I sought confirmation that it is in order for the First Minister to come to this chamber to make government statements, but it's not in order for her to ignore Parliament and instead make statements in front of TV cameras. And at that time, I sought your help to make further representations to the Scottish Government, in particular the First Minister, to the effect that government statements should first be made in Parliament to allow for proper scrutiny and to show respect for our Parliament. I was heartened by the answer you gave on that occasion, and I am further heartened by the statement you have made this afternoon. The reality is that last Thursday at 11:39, 20 minutes before the First Minister's questions, SNP ministers used special powers to ban Scots from going to Manchester and Salford. At 12 noon last Thursday, the First Minister said nothing to Parliament about these new restrictions. The Deputy First Minister, whose name was on the amendment, sat a few feet away from the First Minister. And the next day, at approximately 12:15, the First Minister appeared on television in a staged event to announce the travel ban. Would you, Presiding Officer, take this opportunity to underline again, to make clear to Parliament and to all members of this Parliament, especially members of the Government, that these acts of discourtesy, bordering on contempt by the First Minister, must stop, and that the actions of Scottish ministers must be properly held up to scrutiny by this Scottish Parliament?
Thank you. I thank Mr Kerr for his point of order. I have asked the Scottish Government to reflect on the use of a GIQ when Parliament is sitting, and as I have said previously, and in accordance with guidance on ministerial statements, all significant and substantive announcements should be made to this Parliament wherever that is possible. We now move to topical questions, and I call Graham Simpson for question number 1.
Thank you, Presiding Officer. To ask the Scottish Government on what basis it has introduced a ban on non-essential travel between Scotland and Manchester and Salford.
Cabinet Secretary John Swinney.
Thank you, Presiding Officer. The Common Travel Area travel restrictions were introduced in November 2020. Decisions on which areas are subject to these restrictions are made on the basis of incidence and test positivity rates, other epidemiological factors such as hospitalisations, intensive care admissions and deaths, and presence of variants of concern. Restrictions on travel to and from Blackburn with Darwin and Bolton in North West England and Bedford in the east of England were introduced on the 24th of May. We removed the restrictions on Bedford as well as restrictions on travel to and from the Republic of Ireland on Friday the 18th of June because we judged the relative risk of travel to and from those areas had reduced. Additional restrictions were introduced on travel to and from Manchester and Salford from the 21st of June because we judged that the risk had increased. These additions were all linked to severely elevated case rates associated with the Delta variant. All of these recent changes were notified to Parliament in a written statement through a government-initiated question and announced to the public in the First Minister's media briefing with an accompanying press notice and guidance on the Scottish Government website.
Graham Simpson.
Can I thank the Cabinet Secretary for that answer? I noticed he gave absolutely no figures in the answer whatsoever, so the public will be quite bemused by it. The legislation, in fact, is completely incoherent. It says that you have to leave Scotland with the intention of going to Manchester in order to be in breach of this law. I don't know how you can prove that. I could set off from my home in East Kilbride, go down to visit my mother in Carlisle, suddenly decide I'm going to pop down to see a mate in Manchester and not be in breach of this law. How can this possibly be enforced? Are we going to have police at the border asking people where they're going? Well, of course we aren't. Well, of course we aren't. The law is unworkable and unenforceable. Now, with respect to the Cabinet Secretary's answer, how does he answer the very fair point that infection rates in parts of Greater Manchester, like Bolton, are lower than Dundee? Bolton has a COVID rate of 269 per 100,000.
Thank you, Mr.
How is
Simpson.
that consistent or fair?
Cabinet Secretary.
Presiding Officer, when Bolton was added, Bolton was added on the 24th of May, and that was announced to Parliament by government-initiated question, just exactly the same way as the announcement was made about Manchester and Salford. And I completely accept and respect the words that the presiding officer has expressed today, and the government will reflect very carefully on the points that the presiding officer has made. We felt we were notifying Parliament properly because on the Bolton example, we had used that mechanism before. If that mechanism is no longer judged to be appropriate, then the government, of course, will reflect on that. But we were simply using the same mechanism that we had used back in May when we announced the decision on Bolton. So, the government will take away what the presiding officer has said, because we do respect Parliament, because we notified Parliament on Thursday afternoon. And if members of the Conservative Party couldn't be bothered looking at their emails on Thursday afternoon at 2:39, then I can, as the saying goes, you could take the horse to water, but you can't make it drink. Now, when Bolton was added, case rates were at 283. They were nearly 3 times that of Glasgow at that moment on the 24th of May. So that was the reason, the variation in elevated case rates. Mr Simpson asked me for more data. In relation to Manchester and Salford, Manchester was sitting at 348, Salford at 337, in excess of any case rates within Scotland and well above the Scottish average. So we took those decisions based on trying to minimise the contact that we know enables the spread of the virus. That's what the whole restrictions have been about, and that was the basis of our decision to protect people in Scotland from the spread of the virus.
Graham Simpson.
If the Cabinet Secretary thinks an email is showing respect to this Parliament, then he's looking at it completely the wrong way, because it does not. The fact is the case rates in Manchester were very similar to those of Dundee. He's not addressed that point. Now, if I can move on to another point. Some people, because of this edict from the First Minister, have lost hundreds of pounds. But it's not just individuals who've lost out. The travel sector, which has been hollowed out, is also the loser here. So will the Scottish Government compensate individuals and businesses who've lost money because of this decision?
Cabinet Secretary.
Well, first of all, I would say to Mr Simpson that the government answered a government-inspired question on Thursday, which has been viewed, and I've gone through this detail before, which was nobody raised any issues about us using a government-initiated question to set out the restrictions on Bolton on the 24th of May and Bedford and other places. If the view is now that that's not an acceptable way, the government, of course, will reflect on that and address any issues that Parliament wishes to raise. Now, on the case numbers, Mr Simpson raises the issue of Manchester and Salford again. The case numbers in that area were over 337 is the lowest, compared to a 7-day incidence rate above in Scotland at that particular time. So I think that the case numbers are what, and the epidemiological advice is what drives these decisions. Now, in relation to the question of any compensation, the Government does not believe that would be appropriate. Travel to the North West of England has previously been prohibited last year before local levels regulations were introduced. And no compensation was offered. We are all responsible for putting in place in our respective parts of the United Kingdom the financial support arrangements for business, and that's exactly what the Government will continue to do here in Scotland.
Thank you. There's a great deal of interest in this subject, and I would be very grateful for short questions and succinct responses, please. And I call Jackie Bailey to be followed by Brian Whittle.
The Cabinet Secretary will be aware that the Mayor of Manchester is seeking compensation for those people who had booked holidays in Scotland, which have now been cancelled as a result. The tourism industry has had a really difficult time, and losing bookings will come as a bitter blow, whether it's from Manchester or indeed anywhere else. Can the Cabinet Secretary commit to putting an additional support scheme in place so that tourism businesses do not have to bear the brunt of decisions about travel bans?
Cabinet Secretary.
As Jackie Bailey knows, the Government continues to keep under review business support. The First Minister is going to make a statement in a few moments which will set out some further developments in relation to the wider context and the strategic framework for the handling of coronavirus. Some of those issues that Jackie Bailey raises will be addressed in the statement the First Minister will make, so I won't preempt that. But I would say that the Government has put in place a range of different supports for tourism businesses, as with many other businesses, to take people through these difficult times, and we will continue to ensure that we address any issues that are raised by individual sectors to the greatest ability of the financial scope that we have at our disposal.
I call Brian Whittle to be followed by Douglas Ross.
Thank you, Presiding Officer. Mrs Swinney was heard on the media discussing that decisions made by the Scottish Government are now based on vaccination levels and hospitalisation levels, which is contrary to what Nicola Sturgeon suggested, that ban on travel to Manchester was 100,000. The question is, are the Scottish Government following the science? What is it? Or are they now just making it up, as many of us now think?
I'm not sure to what extent the Cabinet Secretary was able to understand that question.
Well, Presiding Officer, all I would say to Mr Whittle's question is that the Government has set out very clearly over many weeks and months the focus that we have had on applying restrictions where it is appropriate based on the development of the pandemic. Increasingly in the last few weeks, we have begun to focus on as vaccination rates have increased, on the relative balance between case numbers, levels of hospitalisation, levels of ICU presence and admittance, and the level of cases around the country. And as we see the effect of the vaccination programme, that will continue to be the basis upon which we make our decisions, and that has informed the decision-making that the Government has undertaken in this particular case as well.
And Douglas Ross.
Deputy First Minister has used on a number of occasions an example of the 24th of May being a reason for a government-initiated question, and no issues were raised then. Does he know and understand that the 24th of May was a Monday, therefore not a parliamentary sitting day, and last Thursday's decision to use a government-initiated question was a sitting day when ministers such as himself could have announced it to Parliament and be questioned by MSPs?
Cabinet Secretary.
All I would say to Mr Ross is that I hear what he's saying. The Presiding Officer has made her remarks. We will, of course, reflect very carefully on the points that the Presiding Officer has raised, because we were in using a government-initiated question, which are lodged on sitting days very frequently on many issues in relation to COVID. There's many government-initiated questions on COVID are lodged on sitting days, so we will, of course, reflect on what the presiding officer has said to make sure that we properly advise Parliament of changes. But what I would say to Mr Ross again is that government-initiated questions are an acceptable means, accepted by the presiding officer, of the government notifying Parliament of particular developments. We have followed that route, but we will of course reflect on the points the presiding officer has raised this afternoon.
Thank you. Move on to question number 2, Pauline McNeill.
To ask the Scottish Government what action it is taking to reduce the number of female prisoners on remand following reports that 1 in 4 women in custody are awaiting trial.
Minister Ash Denham.
Decisions on bail, remand and sentence in individual cases are of course a matter for the independent courts based on the circumstances that are before them. But nevertheless, the Scottish Government has made clear that we believe the numbers on remand in our prisons, especially for women, is too high. And I recognise that an ambition to reduce the use of remand is shared by other parties in this chamber, and I welcome your support and ideas. The single biggest factor in the increase in the proportion of prisoners held on remand is the backlog of cases created by the pandemic, and we are committed to helping the justice services recover. And this includes providing an additional £50 million in this financial year so that cases involving all accused, including those on remand, can be progressed and justice can be carried out in each case. A number of actions are underway to help reduce the use of remand, and at the end of last year, the Scottish Government introduced regulations to Parliament as the first step in introducing electronically monitored bail. And once all of our partners have confirmed that they're operationally ready, this measure will provide the judiciary with another tool to utilise when considering bail and remand. We also plan to explore how the overarching legal framework within which decisions of remand are made could be adjusted. And in line with the findings of the report by the Commission on Women Offenders by the former Lord Advocate Dame Eilish Angelini, we recognise the disruption periods of remand cause individuals, their families and also their communities. And that's why we are continuing to strengthen the provision of credible alternatives to remand, supported by an investment of £550,000 in bail supervision each year. And this is in addition to the £107 million invested in community justice services annually, which includes a ring-fenced allocation of £1.5 million bail support for women. And finally, as part of my new remit, I welcome this opportunity to work across parties and also with key stakeholders and others representing women in the justice system to identify further actions that can help ensure that remand is used only when necessary to protect public safety and where no appropriate alternative is available.
We will require shorter responses as we have a great deal of business to get through this afternoon. I call Pauline McNeill.
I thank the Minister for what was quite a lengthy response. Time spent in prison can have a catastrophic effect on women's lives, causing them to lose their homes, custody of their children and their job. The Amnesty International reminds us that the detention of individuals who are awaiting trial is a matter of special concern because they have yet to be found guilty of any offence and therefore innocent in the eyes of the law. But worryingly, Scottish prisons have a greater proportion of women in remand than the rest of the UK, and of those women on remand, 3/4 will not get a custodial sentence. I hope the Minister would agree that something is not right here. You mentioned the Scottish Government is about to adopt the Angelini report, but this came about 9 years ago, and there was a proposition that the provision of bail supervision should be consistently available across Scotland. I ask the Minister, why has it taken 9 years to bring this forward?
Minister.
We have been working ongoing on issues across this area, and I would say to the member and also to the chamber that we absolutely recognise how disruptive to individuals, to families and communities that periods on remand should be. It should only be used when it's absolutely necessary to protect public safety and where no appropriate alternative exists. I am determined to make progress on this issue, and I hope the member would accept that we have made progress in this issue and on the wider piece for women and justice. For instance, our work on the presumption against short sentences, our work on the new women's prison estate, our work on electronically monitored bail and our investment into community justice. All of these things are part of a picture, a step forward, if you like. So I will look at what more we can do, and I invite the member to work with me in this as well. But on bail supervision, as the member requested an update on that, we have invested on bail supervision services. It is, of course, an important alternative to remand. It's run, obviously, by the local authorities, Justice Social Work Services, and since April 2019, additional funding of £550,000 has been provided to increase capacity for bail supervision, and the latest statistics show encouraging evidence of impact, with the highest level of use of bail supervision in 7 years. That's a total of 470 bail supervision cases were commenced, and in 2019-20, that's a 40% increase on 2018-19.
Thank you. Pauline McNeill.
Presiding officer, I mean, it's going to be difficult at topical questions if a member like me asks a question about remand and I get a whole policy issue which I didn't ask about. What I'm asking about is the issue of remand. By the end of April, close to 1 in 4 prisoners in Scotland were on remand, and that's nearly 42.6% of young people aged between the age of 16 and 20 in prison were on remand. 57% of people held on remand do not go on to receive a prison sentence, and they are found either not guilty or receive a community sentence. So I'm not confident that the Scottish Government really take on the importance and the human rights considerations. So I ask, what is the Scottish Government's approach to this in terms of human rights? In January last year, the Scottish Government commissioned research into the reasons behind decisions on bail and remand in order to try and reduce the number of people, but it was put on hold. I do acknowledge that that was due to the pandemic, but can the Minister tell me when this research will be recommenced?
Minister.
A number of points to that question. I'm not sure if I'll be able to cover all of them in my reply, so I'll follow up with a member if I miss any points out there. We do absolutely take this issue very seriously, but I would remind the member that decisions on bail are made by the independent courts, and in all circumstances of the case, according to the statutory framework, which explicitly sets out public safety and substantial risks of the person committing further offences. And in Scots law, there is generally a presumption in favour of bail, and this is a requirement of the European Convention of Human Rights. So what I was setting out to the member is a wider piece of work here, that we obviously have to invest in alternatives to remand, and that's what I was setting out to the member, the pieces of work that we're taking forward. So that is on electronically monitored bail, and that will be implemented shortly. The investment that the Scottish Government is making on bail supervision, with money specifically ring-fenced to support women in that, and also our additional funding that we've put into community justice.
Thank you. We'll move on to question number 3. Emma Roddick.
Ask the Scottish Government what discussions it has had with the Home Office regarding the reported backlog in processing applications for the EU settlement scheme.
Cabinet Secretary Angus Robertson.
Thank you very much, Madam Presiding Officer. It is unacceptable that with 8 days to go to the EU settlement scheme deadline, there's a backlog now of over 300,000 unresolved cases. The Scottish Government has consistently been clear that the deadline should be extended. The Minister for Culture, Europe and International Development wrote to Lord Frost on the 16th of June, requesting a discussion on the issue at EU Exit Committee meetings. We have yet to receive a response. I also requested an extension when I met with the UK Minister for Immigration Compliance, and will continue to do everything we can to support EU citizens, including seeking an extension.
Emma Roddick.
I thank the Cabinet Secretary for his response. The settled status deadline poses huge risks to EU nationals who have contributed so much to our society. It would simply be unacceptable for people to lose their rights overnight. It is, of course, wrong that EU nationals living here are being forced by the UK Government to apply to stay in Scotland, but given they have to do so, what steps are the Scottish Government taking to encourage all EU nationals to apply before the deadline?
Cabinet Secretary.
I completely agree with the member that the upcoming deadline poses significant unfair risks to EU nationals, and we have continuously requested at the very least an extension to the EU SS deadline. Let me be clear that any refusal to extend that deadline is a choice by the UK Government. This government in Scotland is supporting EU citizens through our Stay in Scotland campaign. We spent more than £1 million helping people to apply to the EUSS scheme through this campaign. That includes media campaigns across radio, digital and social media platforms, and toolkits providing information and signposting to be made available to EU citizens. The funding also offers advice and support through Citizens Advice Scotland, the Citizens' Right Project and Just Right Scotland guidance for the rights of EU citizens.
Emma Roddick.
Thank you. Many key sectors in Scotland, and in particular here in the Highlands, such as hospitality and farming, are already struggling to recruit employees as a result of Brexit. There couldn't be a worse time to risk compounding this problem if people lose their right to work as a result of this deadline. Is the Cabinet Secretary concerned that this reckless Tory policy could risk damaging Scotland's recovery from the pandemic?
Cabinet Secretary.
I'm very concerned that this policy will harm our key sectors across Scotland. It's my view and that of the Scottish Government that EU citizens living in the UK should not need to apply to retain the rights that they already have had to live, work and study in Scotland. The EU settlement scheme should be replaced with a declarative scheme that automatically allows EU citizens to retain their rights. At the very least, the UK Government should extend the deadline for applying to the EU settlement scheme.
Thank you. That concludes topical questions, and I regret that I've been unable to take more supplementaries, and I would ask colleagues that as we progress through this afternoon's business that we remain courteous at all times to other members in the Chamber, and please keep questions and responses succinct. The next item of business is a statement by Nicola Sturgeon on a COVID-19 update. The First Minister will take questions at the end of her statement, and so there should be no interventions or interruptions, and I call on Nicola Sturgeon.
Today's statement, Presiding Officer, contains several important updates. First of all, as I indicated last week, I can confirm that no part of the country will change COVID level next week. Apart from some minor amendments that I'll cover later, restrictions in all parts of the country from Monday will be unchanged. I'll also provide an update on vaccination milestones and set out indicative dates for the further lifting of restrictions as we hope to move into and beyond level 0 and back to normality. Firstly, though, today's statistics, and these do demonstrate why caution at this stage is still required. Yesterday, 2,167 positive cases were reported. That is a positivity rate of 9.1%. The total number of confirmed cases is now 257,742. 171 people are currently in hospital, 12 more than yesterday, and 18 people are receiving intensive care. That is 3 more than yesterday. Sadly, 4 deaths were reported yesterday, and the total number of deaths under this daily definition is now 7,696. And again, I send my condolences to those who have lost a loved one. On vaccination, I can report that as of 7:30 this morning, 3,664,571 people have received a first dose. That's an increase of 17,134 since yesterday. In addition, 15,783 people received a second dose yesterday. So the total number of second doses now administered is 2,602,753. The news on vaccination continues to be extremely positive, but of course this has to be balanced against the continued rise in cases. The number of new cases recorded over the past week has increased by almost 40% on the week before. That total is 7 times higher than in early May and higher than at any point since late January. This reflects the fact that the faster transmitting Delta variant is now dominant. Obviously, we cannot be complacent about this. However, we do have evidence that the link between new cases and serious health harm is weakening. The number of people being admitted to hospital with COVID has fallen from around 10% of reported positive cases at the start of the year to around 5% now. And COVID patients, on average, are spending less time in hospital, though we should remember that even if they don't need hospital treatment, some people will suffer significant health harms, including long COVID. However, overall, the evidence that vaccination is helping protect people from serious health harms is allowing us to change how we respond to the virus. Today's total of new positive tests is the largest we've seen since the peak in January. These numbers still shock. The virus is still with us, but the vaccines are protecting more of us. I will never regard any single death from this virus as anything other than a human tragedy. And as cases rise, we can expect to see more deaths in coming weeks. Back in January, however, we were seeing daily figures of more than 50 people dying. I expect and I profoundly hope that the link between cases, hospital admissions and deaths will continue to weaken as more and more of us are fully vaccinated. And so in making decisions about when we lift restrictions further, progress with vaccination is a significant factor. So I want to set out now the milestones we will reach in the coming weeks, assuming, of course, that supplies are as expected. By this coming Sunday, we will have vaccinated with 2 doses everyone in the top 9 JCVI priority groups. Of course, there might be some people who can't attend an appointment this week and so get their second dose a bit later. There may also be some people, hopefully very few, who don't attend a scheduled appointment. These caveats, of course, apply to the other vaccination milestones I'm about to set out. But essentially, by the end of this week, we will have completed vaccination for priority groups 1 to 9. These groups include everyone over the age of 50, all unpaid carers and people with underlying health conditions, and they account for well over half of the adult population. It's also estimated that prior to the vaccination programme, these groups accounted for 99% of all COVID deaths. So the fact that virtually all of them will be fully vaccinated by the end of this week is hugely significant. The next milestone will be the 18th of July. By then, all adults will have had the first dose of vaccine, and this is significantly ahead of schedule. And then, by the 26th of July, we expect to have given second doses to all 40 to 49-year-olds. By the 20th of August, all 30 to 39-year-olds will have had a second dose. And finally, we expect to have completed second doses for all adults by the 12th of September. We're also planning for possible future vaccination programmes, depending on the advice we get from the JCVI. This could include booster jags this autumn and, of course, potential vaccination of 12 to 17-year-olds. There's no doubt vaccination offers us the route out of this pandemic. We know that getting both doses provides good protection, including against the Delta variant. So these milestones are really important and they inform the decisions that I will set out today. Also underpinning these decisions and providing some more context for them are 2 new papers, substantive new papers we are publishing today. The first is a revised strategic framework for tackling COVID. Central to this is an updated strategic aim for our pandemic response. Up until now, the Scottish Government's strategic intention has been to suppress the virus to the lowest possible level and keep it there. From now, our aim will be to suppress the virus to a level consistent with alleviating its harms while we recover and rebuild for a better future. This change reflects the fact that vaccination is reducing, we hope significantly, the harm that the virus causes. Vaccination means it is now possible, indeed it is perhaps necessary, to shift our strategic aim and reduce the wider health, social and economic harms that strict lockdown measures cause. The second paper we are publishing today is the review of physical distancing. Physical distancing has been an important mitigation against the virus, but it is also burdensome for individuals and, of course, costly for businesses. So as vaccinations bear more of the load of controlling the virus, we need to consider when and to what extent we can reduce the legal requirement for it. Ultimately, we hope to remove the legal requirement for physical distancing, even though we may for a period continue to advise people to think about safe distancing when interacting with people outside their close contact groups. So let me turn now to the changes that we hope to make in the weeks ahead. At the moment, the high number of new COVID cases being recorded is a significant consideration. To use the race analogy that many have used before, we must not allow the virus to get too far ahead of the vaccines. Therefore, as indicated last week, we intend to maintain the current restrictions applicable in each part of Scotland for the next 3 weeks. Within those levels, though, we will make some minor but important changes to the rules on weddings and funerals. These will take effect from Monday, 28th June. For example, suppliers of wedding services and other people employed by a couple getting married will no longer count towards the cap on numbers. Those accompanying a wedding couple down the aisle will no longer need to wear face coverings. Live entertainment at receptions will be possible, although people will still need to be seated at tables. And we'll change also the guidance for funerals so that people from more than one household can help carry a coffin and take a cord when lowering it. We expect these changes to have a relatively minor impact on transmission. They are relatively minor changes, but I hope they will make some difference to those organising and attending weddings and funerals ahead of the more substantive changes that we hope to see at level 0 next month. With the exception of these changes, our assumption, based on recent case numbers, is that current levels will remain in force until the 19th of July, although obviously we continue to keep that under review. Let me turn now to when we hope to lift remaining restrictions. Now, I want to be clear that what I am about to set out represents our best judgment at this stage of what is likely to strike a sensible balance. It is intended to give as much clarity as possible. However, it is contingent on meeting our vaccination milestones and, of course, the revised strategic aim of alleviating the harms of the virus. If the data in the coming weeks suggests we can go faster, we will do so. Conversely, if the data says we need to slow down, we will do that too, though I very much hope that will not be necessary. The next scheduled review point will be the 19th of July, though we will confirm the position a week in advance as usual. By the 19th of July, 3 weeks will have elapsed since the completion of the vaccination programme for over 50s, which means that the vaccine will be giving everyone in that age group a significant level of protection. Therefore, assuming we're meeting the revised strategic aim, we hope that all parts of Scotland, not currently in that level, will move to level 0 on the 19th of July. That means, for example, that the limits for household gatherings indoors will increase from that date, and up to 200 people will be able to attend weddings and funerals. We also hope, assuming the data supports this, that the general indoor physical distancing requirement can be reduced from 2 metres to 1 metre from that date. And we hope also from that date to lift the outdoor requirement to physically distance altogether. In addition, in recognition of the reduced risk of outdoor transmission and therefore the desire to encourage people to stay outdoors as much as possible, especially over the summer, we hope that limits on informal outdoor social gatherings in private gardens, for example, will be removed at this stage. So rather than the current rules for level 0, which state that up to 15 people from 15 households can meet outdoors, informal social gatherings of any size will be allowed. We will, however, keep in place temporarily the rules and processes currently applicable at level 0 for organised outdoor events, given these can attract much larger crowds. If we can move, as hoped, to level 0 on the 19th of July, that will be a significant step back to normality. But we have always been clear that level 0 cannot be an end point. Some of the restrictions it entails are still significant, for example, the household limit for indoor gatherings. So we want to move beyond level 0 as quickly as it is prudent to do so. The updated strategic framework sets out what that means. In short, while we're still likely to need some baseline measures, it means the lifting of the remaining major legal restrictions. In reaching a view on when that can be done, we have considered the harm to health and the strain on the NHS that could be caused if COVID cases continue to rise. And I must stress to Parliament that even with a reduced ratio of cases to hospitalisation, case numbers at the level being recorded just now could still put significant pressure on the NHS. We must be mindful of that. But we have also considered the wider harms that restrictions cause, and we have considered how reasonable and proportionate it is to require people to comply with these legal restrictions as we meet vaccine milestones, and if evidence continues to show, as we hope it will, that vaccination is protecting more and more people from serious health impacts. I mentioned earlier that we expect to have completed second doses for all over 40s by 26 July. We know that the protective effect of the second dose takes a bit of time to build up, but within 2 weeks, by 9th August, we would expect the vast majority of over 40s to have a significant level of protection. Of course, we need to remember that vaccination doesn't provide 100% protection, and it won't be until later in September that all adults will have the protection of full vaccination. However, our assessment on balance, and assuming that we meet the necessary conditions on vaccination and harm reduction, is that it would be possible and proportionate to lift the major remaining legal restrictions on the 9th of August. We will consider and make a final assessment nearer the time of whether, as we hope, this could include the lifting of the legal requirement to physically distance indoors as well as outdoors. The move beyond level 0 will be a major milestone, and it will signal a return to almost complete normality in our day-to-day lives. Of course, while this is a longed-for moment, it is important to recognise that we still have a difficult path to navigate over the next few weeks to meet these milestones. And even assuming we do, as we hope we will, the pandemic will not be completely over at this stage. As our strategic framework update paper sets out, basic mitigations will still be required as we move through summer and into the autumn, when we face the risk of a further resurgence in cases. Measures such as rigorous and regular hand washing, cleaning surfaces and good ventilation will continue to be vital. And even if, as we hope to, we lift the legal requirement, we may still advise keeping a careful distance from people outside our close contact groups, especially if they are not fully vaccinated. Also, at least for a period, we are likely to require continued wearing of face coverings in certain settings, for example shops and public transport. Test and Protect will also remain a vital part of our approach. Regular testing will still be advised for a period at least, and while we are considering the impact of vaccination on self-isolation, isolation will continue to be necessary in certain circumstances, especially for those who test positive. There will also be a need to manage outbreaks as and when they arise, and the level system will still be available to help us do that if necessary. We all hope that we will not see a further variant against which our vaccines are less effective, but we do need to retain the ability to respond if that happens, both with updated vaccines and, if necessary, with other measures. Also, we will not advise an immediate return to full office working on the 9th of August. Instead, we will continue to work with business to agree an appropriate phasing of this, beginning when we enter level 0, we hope on the 19th of July. However, I think many would agree that as a general principle, home working should be more possible post-COVID than it was before. So while recognising that a return to the workplace will be right for many, we will encourage continued support for home working where that is possible and appropriate. This won't just assist with control of the virus, it will also help promote well-being more generally. And while we will continue to keep the need for travel restrictions under review, it is likely that some targeted restrictions will be needed after 9th August as new variants continue to pose the biggest threat to our progress. Finally, we'll also work over the summer to plan for the return of schools, colleges and universities. For the moment, though, I want to take the opportunity to say a heartfelt thank you to everyone in education. Most schools and many early learning and childcare settings are about to break for the summer holidays. Colleges and universities are also nearing the end of term. For everyone working in education, this will have been the toughest and most distressing year of your professional career. I am grateful for everything you have done to keep nurseries and childcare facilities, schools, colleges and universities going in such difficult circumstances. We will be working to do everything possible to minimise any further COVID disruption in the next academic term. Presiding Officer, we must remember that this is a global pandemic. It will not be completely over here until it is over across the world. Unfortunately, the world is still some way from that. However, here in Scotland, while transmission is causing concern at the moment, vaccination is giving us much of the protection that only harsh restrictions have been able to give us so far. So that means we can now plan to move much more firmly and with much greater confidence from the need to control the virus through tough restrictions to being able to live much more freely. That is good news. We must be careful still, but from the 19th of July and then more substantially from the 9th of August, assuming we are meeting our revised strategic aim of alleviating the harm of the virus, life should feel much less restricted for all of us. A very significant degree of normality will be restored for individuals and for businesses. As I said earlier, these are indicative dates, but they allow us to plan ahead with more clarity. As always, though, we all have a part to play in keeping us on track. So I will end with a reminder of the key asks of everyone across the country. The first is vaccination. Please get vaccinated when invited to do so, and please attend for both doses. If you need to rearrange, or if you think you should have had an invitation by now, please go to the vaccination section of the NHS Inform website. If you've had your first dose of the vaccine 8 weeks or more ago, check on the website to see if you can bring your second dose forward. Secondly, please do test yourself regularly. Free lateral flow tests are available through NHS Inform. They can be ordered through the post or collected from local and regional test sites, and also now, of course, from community pharmacies. If you test positive, please self-isolate and get the result confirmed through a PCR test. And finally, please continue to stick to the rules where you live and follow all the public health advice. This is still really important. The virus is still out there and it is spreading, so please continue to follow advice on physical distancing, hand washing and face coverings. Try to meet others outdoors as much as possible. We know that no environment is entirely risk-free, but outdoors is much less risky than indoors. If you are meeting indoors, though, please stick to the limits for now and make sure the room is well ventilated. And that does apply when watching the football too. We all know that tonight's game is absolutely massive. Let me take the opportunity, I'm sure on behalf of all of us, to wish Steve Clarke and the team well. We will all be cheering Scotland on this evening, but please do it safely and do it within the rules. Presiding Officer, 6 months ago, when I confirmed to Parliament that tough restrictions were being reimposed, it was the day after the winter solstice, the shortest night of the year. That was one of the darkest moments in the course of this pandemic. For these past 15 months, we have endured restrictions that would have been considered impossible just 2 years ago. The pain suffered and the people lost along the way must never be forgotten. They will never be forgotten. And in a global pandemic, we can't be certain that there won't be difficult moments yet to come. But I hope and I believe that today's statement, just of course a day after the summer solstice, marks a positive turning point. We are now living in more hopeful times. We can now see a route to lifting restrictions and to enjoying again the simple but precious pleasures that we've all missed so much. The path ahead is not obstacle-free. I'm not going to pretend it is, but it is clearer now than at any point so far. Thanks to vaccines, normal life is now much closer. It is within sight. So let's all stick with it and do whatever is required to get us there.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business, and it would be helpful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you very much, Presiding Officer. And could I also express my sympathies and condolences to everyone who's lost a loved one, both over the last 24 hours and indeed throughout the entire time we have been dealing with this awful virus. In the penultimate sentence of the First Minister's statement, she started, "Thanks to the vaccines." And I'm pleased to see in the statement the First Minister acknowledge that there is more evidence that the success of the Scottish and UK vaccination scheme is significantly reducing hospitalisations. That is something we can all welcome. And we can also welcome that we finally have changes to weddings and funeral guidance. Although it's disappointing that this has come so late after so many occasions have already been affected. For the last 2 weeks, I have stood here at these statements and asked the First Minister to consider making immediate changes to the numbers who could attend funerals and weddings, and neither MSPs nor the businesses in the sectors asking for that got a response. So while it is welcome these changes will now be made, the fact that the First Minister calls these minor changes is in fact not the case. These are major changes for the couples who have been asking for them, the businesses who were seeking them, and for too many, however, these changes come too late and they won't be in time for their own ceremony. It's of course welcome that today we have more of an indication of when we will be free from restrictions, and I want to come on to that in a moment. But speaking about welcome, I also want to echo what the First Minister has said, and I hope we can all welcome a solid Scotland win tonight, and I wish Steve Clarke and the team all the very best at kick-off at 8 o'clock. But can I ask the First Minister specifically about the basic mitigations that will remain in place after the 9th of August? Will those mitigations include social distancing, particularly at hospitality venues? Will Well, the First Minister is saying, did I not listen to what she said? I listened very carefully because she made it very clear what is happening when we move to level 0. She then made it very clear what she hopes will happen when we come out of restrictions on the 9th of August. But the statement is very clear that basic mitigations will remain in place. So I think it would be useful just to get clarity on these 3 points. Will social distancing remain in place under these basic mitigations in hospitality venues? Will there be ongoing limits on indoor social gatherings? And finally, will the mitigations after the 9th of August include the wearing of masks in offices and in schools?
First Minister.
I'll try to address all of these points as briefly as possible. On vaccination, the evidence is strong. It is increasing that vaccination is reducing the harm of the virus, and that is both in terms of reducing the numbers of people going to hospital and the length of time people are in hospital. That, of course, is also partly reflective of the fact that as vaccination pushes the impact of the virus down the age ranges, many people going into hospital will be younger than was the case earlier on in the pandemic. That's really good news, but I do want to reiterate a point I made in my statement, because I think it's important that Parliament is aware of this. Back at the start of the pandemic, we effectively, apart from urgent health care, we dedicated almost the entirety of the health service capacity to potentially dealing with COVID cases. We are not able to do that again because we are trying to catch up on a backlog and make sure people get non-COVID treatment. So our margins in terms of what will put pressure on the NHS and what won't are narrower than they were before, which means that even if the ratio of hospitalisations is falling, we think it's probably about halved, perhaps now even more than that. 5% of a big number of cases going to hospital is still going to put significant pressure on our health service. So that link is weakening. That's good news, but it doesn't mean yet we can be completely complacent about case numbers, and that's why over the next 3 weeks continued caution is required. On weddings, I hope I wasn't misunderstood, and if I was, I apologise for that. I wasn't trying in any way to suggest that the changes weren't important. When I called them minor, I meant relative to the changes that I think people really want to see for weddings, which is a significant increase on the cap that is currently on the numbers. That will come if, as I hope we will, we go to level 0 on the 19th of July, when the number goes to 200. What I'm announcing today will slightly ease up the numbers because certain people will not be included in the cap, but I'm not immediately announcing an increase in the cap, and that's why I think if I described that as a major change, I probably would have, and I think more justifiably, had people suggesting that I was overstating that. So it's important, but the major change will come when the cap increases, hopefully on the 19th of July. And of course, over the last 2 weeks, Douglas Ross has been asking me these questions. I'm sure he would concede that case numbers have been rising as well. So there is a need to continue to balance these things carefully. Lastly, Presiding Officer, on basic mitigations. So what I set out in my statement, and remember this is all caveated, we must assess the data near the time, but what we hope will be the case, that as we go to level 0, we hope on the 19th of July, the indoor legal physical distancing requirement will reduce from 2 metres to 1 metre. In hospitality, it is already 1 metre, so that would be the general one, and we hope to remove the legal physical distancing required outdoors at that point completely. And then if we go beyond level 0 at the 9th of August, we hope, but we have to assess the data, that the legal requirement to physical distance will be removed indoors as well as outdoors. So there will be no legal requirement, if all goes according to plan, for physical distancing at all when we go beyond level 0. But we may still advise people, if you're with somebody who's not fully vaccinated, if you're with somebody more vulnerable, if you're in a place where the ventilation is not particularly good, it would make sense to continue to pay attention to a safe distance to people that are not within your close contact group. But that will be advice, not law and not regulation. And again, although no final decision has been taken on this yet, it may be that in some settings, and that may include schools, for example, but no decision has been taken, that for a period longer we ask people to continue to wear face coverings. These are the kind of basic mitigations that we may require once we lift the major legal restrictions that are currently in place. But I think basic mitigations like washing your hands regularly, ventilating a room, cleaning surfaces, compared to what we have all lived with over these past 15 months, I think many of us will think that these are relatively, not insignificant, but relatively small prices to pay to keep this virus under control.
Anna Sarwar.
Thank you, Presiding Officer. And can I start by sending my condolences to all those that have lost a loved one in recent days, but throughout this pandemic. Can I also share the concern about the increase in the positivity rate and the continued spread of the virus across Scotland? We, of course, all hope that we continue to make progress so we can return to a version of normal by the 9th of August. In order to maintain wider health and well-being, we must make sure that the last lockdown really was the last lockdown. But to maintain public trust and confidence through this pandemic, we've got to make sure we maintain effective communication and consistent decision-making. And I'm sorry to say that has frayed in recent weeks. I welcome what the Government has said about setting a clearer timetable around the vaccine. Can we get a commitment that if the supplies allow, we will ramp that up much faster if we can? Can we look to replicate what's happened in London, for example, where we have walk-in vaccination centres for those that aren't registered with a GP, so we can get a spread of the vaccine as much as possible? Do we still have hotspots where we are targeting resources to? If so, we are still waiting for the publication of those hotspot protocols. And can we get a recognition that there is now a frustration amongst particularly lots of business sectors about a lack of communication and working together with the Government? Can we have much clearer financial support protocols and much clearer communication with those sectors to recognise the specific challenges they face, so we can make sure we can give confidence to the public, give confidence to employees and give confidence to employers and come through this crisis together? First Minister.
On all of these things, intensive work is continuing. So hotspot initiatives, local public health teams will continue to take action as appropriate. We, for example, at the moment are doing a much higher rate of PCR testing than other parts of the UK, and that will partly be reflecting some of the surge testing that has been done in local areas. It is for local public health teams to decide what is appropriate, following the protocols that are in place. We are vaccinating as fast as supplies allow. Yes, if supplies allow it, we will accelerate further, but there is one important caveat in that has to be understood, particularly as we go into second doses, that there is a recommended 8 weeks between a first dose and a second dose. So clinically, we can accelerate that, which will to some extent limit the pace that we're able to go at with second doses. But that is clinical advice that it would not be appropriate for us to change. But we will use supplies as quickly as possible within the clinical advice that is available to us. Health boards are using drop-in clinics where they think that is appropriate. Obviously, that becomes more important and is being used in other places for younger people. But if you look at first doses right now, and all 4 UK nations are much of a muchness in terms of vaccination uptake, but we're slightly ahead of England and Northern Ireland in first dose vaccination, which suggests that we are doing all the things that everybody else is doing and getting through that population quickly. But we will work with health boards to make sure that they have all of the support that they need. And the Finance Secretary will continue to work with businesses to make sure that the financial support that is available is understood and, more importantly, that is accessed by businesses as we continue this journey back to, I hope, significant normality.
Thank you. Patrick Harvey.
I thank the First Minister for the statement, and I join with others in once again expressing my condolences to those who have lost a loved one, or indeed to those whose health and well-being has been seriously harmed for the long term by this virus. But I also share the sense of hope that we might finally, after such a long and difficult period, be coming to the end of the restrictions. I want to ask about the change of strategic approach from the Scottish Government, and in particular the strategic intention to suppress the virus to the lowest possible level, no longer being the Government's position. Does this imply that the Scottish Government is open to what Matt Hancock is proposing, to end the requirement for international travel quarantine for vaccinated people, or indeed what he suggested to end self-isolation and replace it with lateral flow testing, something which has been criticised by public health experts? Or does the First Minister share my concern that wherever in the world further, more dangerous variants emerge, this approach would almost guarantee that those variants were imported and would then spread?
First Minister.
The latter doesn't automatically follow the former. In terms of the change to the strategic intent, that really is recognising the way in which and the extent to which vaccination is changing the reality of the impact of this virus. When there was no vaccine, then, in my view, it was essential to try to suppress cases of the virus to the lowest possible level, because you had no other way of reducing the harm. And although those restrictions that were necessary to achieve that did other harm, the harm that would have been done by the virus outweighed those. That balance changes when you have a vaccine that helps to mitigate the harm of the virus, and therefore to continue to seek to suppress to the lowest possible level becomes potentially disproportionate, because the harm that's been done by the restrictions necessary to achieve that outweigh the harm of the virus. So that's the reason for the shift in strategic intent. But with both, it is about reducing the harm of the virus. It's just that there are different ways with a vaccine to do that than has been the case previously. We want to see both testing and vaccines, and I think particularly vaccines, progressively reduce restrictions domestically and, of course, in time restrictions on travel in and out of the country. We have to consider that carefully, because we have to be satisfied that there is a degree of effectiveness in those substitutes that allow us to move that. So yes, we of course will consider, I alluded to this in my statement, we will consider whether testing in future coupled with vaccination can lead to a different approach to self-isolation, particularly for contacts of positive cases, even if not for positive cases themselves. We're not yet at a stage to take that decision, but that is under active consideration. And we all want to look to a point, hopefully in the not too distant future, when vaccines can open up travel again as well. But we do know that the biggest risk we face is a variant at some point undermining the effectiveness of the vaccine. So that means we need to take continued care and really look at all of these things carefully before coming to final decisions. But all of these things are and will continue to be under active consideration.
I call Willie Rennie to be followed by Kenneth Gibson.
Every week, families of adults with special needs ask me when their day services will reopen. Every week, I ask the First Minister the same, and every week, nothing changes. Last weekend, those families witnessed thousands of fans travelling hundreds of miles to gather on the streets of London against official advice from the government. The families were surprised there were few words of criticism, especially from the First Minister. Can the First Minister understand how angry they feel? They feel left behind. Others do too. All they want is fairness for their services to be reopened. Will the First Minister agree to that today?
First Minister.
Well, if Willie Rennie had, as I'm sure he was, paid close attention, he would have heard today something that will make possibly the biggest practical difference here. Firstly, on football fans, I could not have been clearer that I advised against fans travelling to London, as I advise against fans gathering in groups that are out with the limits. I have spent 15 months trying to persuade people, and the vast majority of people have complied with that, to stick to rules that are about keeping them and their loved ones safe. I get frustrated when people do not do that, but we all have a personal responsibility, and we're moving into a phase where that personal responsibility is going to become more, not less important, as we progressively ease legal restrictions. So I'll continue to every day, I'll continue to persuade people, or seek to persuade people, to behave in a way that is within both the spirit and the letter of the rules to keep us as safe and as on the right track as possible. The issue I refer to, as I said last week, it is not the case that services for adults with learning disabilities cannot open. Local authorities have to consider how they safely open. The biggest restriction at the moment is on physical distancing and the 2-metre physical distancing. That is one of the reasons why we are keen to reduce to the point of eliminating completely the need for a legal requirement for physical distancing. So if we go to level 0 on the 19th of July, and if that allows us to reduce indoor physical distancing to 1 metre, that will significantly increase the capacity in services like this and in many other settings as well. That doesn't mean these services are closed between now and then, but it does mean that local authorities or the providers of these services can continue to plan for increasing the capacity further. My final point, no matter how frustrated we may get when people, whoever they are, football fans or anybody else, are not complying with the advice, the response to that is not to reduce protections for other people, including and in particular vulnerable people. This is really difficult for people in that category. I absolutely understand this, but getting everybody through this as safely as possible is what continues to be most important.
I call Kenneth Gibson to be followed by Liz Smith.
Thank you, Presiding Officer. I welcome the First Minister's statement. Wearing face coverings in shops, travelling and at work has become second nature to many and continues to be necessary, but doing so is neither pleasant nor particularly comfortable. One or two public health advisers even suggest that face coverings should become permanent. Whilst no change is envisaged at present, does the First Minister agree that ultimately we should aim to return to being mask-free once it is safe to do so?
First Minister.
Yes, I do. I personally don't want to have to wear face coverings for longer than is necessary, and I can't imagine there are many people across the country who do. I want to see us get to a position where we don't have to think about COVID in our day-to-day lives in any respect. We are much closer to a position where we can lift legal restrictions, and I think that is welcome. But if we want to continue in that way, we may have to, all of us, accept basic mitigations for a period longer. I certainly hope that is not for a significant period longer, but things like wearing face coverings, washing hands, keeping, even if it's not legally required, a careful, safe distance in certain circumstances from other people. If these are the things that are required so that we can live without the limits on having people in our own homes, or the limits in what we can do in the much more fundamental parts of our life, the limits on services for adults with learning disabilities, then I think that is a price people are willing to pay, albeit we all hope that that will not be for any longer than is necessary.
Liz Smith, to be followed by Gillian Martin.
Thank you. Scottish universities are reporting that the number of students likely to arrive from red list countries for the start of the new academic term in September is likely to exceed the hotel quarantine allocation, and complaining that this issue has not been addressed in good time. Can I ask the First Minister why that is the case and what would be done to address these very serious concerns?
First Minister.
Well, we are working with universities. I'll ask the Education Secretary to write on this specific point. Of course, universities also have an obligation to make sure that they have in place the services and support that international students need. Obviously, these are fee-paying students. We are also, of course, giving access to the vaccination programme for international students arriving here if they're coming from countries where they haven't already been vaccinated. So these are issues that will be taken very seriously. We learned a great deal, not all of it good, from the experience of university return last year, and a lot of work is going on to make sure that the right arrangements are in place this year.
Thank you. Gillian Martin, to be followed by Jackie Bailey.
Thank you, Presiding Officer. I've had a constituent get in touch pointing to studies in other countries in relation to vaccine efficacy in people who are solid organ transplant recipients. And those studies are saying that they indicate a much lower efficacy rate than the rest of the population. Can I ask the First Minister what's been done to ascertain the efficacy of the vaccines in people whose immune systems are suppressed, and what steps have been taken to maximise their protection?
First Minister.
Well, the JCVI priority list represents, as I said in my statement, 99% of preventable mortality from COVID. Those who are clinically extremely vulnerable were prioritised for vaccination, with around 95% of those in the shielding list having now received both doses. The JCVI did consider emerging advice suggesting people who are severely immunosuppressed may not always get the same protection from vaccination as others. Households of adults who are severely immune compromised, those should now be vaccinated alongside JCVI priority group 6 to offer additional protection. But of course there are ongoing studies, and I'm sure there will be for some time, into the efficacy of the vaccines both generally and in relation to particular groups.
Jackie Bailey, to be followed by John Mason.
Just this week, Dumbarton Academy completely closed down due to an outbreak of COVID, and it will remain so for this final week of term. The situation is bad at the Vale of Leven Academy, and what is concerning is that parents and pupils were advised late, in one case 4 days after contact with a person who tested COVID positive. They also visited elderly relatives over the weekend. In the case of a local gymnastics club with 40 members, they were only told of a COVID positive case 7 days later. Does the First Minister agree that unless we speed up the time in which people are notified by Test and Protect or indeed the school, then the virus will simply continue to spread?
First Minister.
Test and Protect and the times for Test and Protect contacting and tracing people are published, actually. I'm pretty sure they're still published on a weekly basis, so people can look and see that. Test and Protect perform a very good service and to short timescales. In some circumstances, particularly complex outbreaks, it will take time to go through all contacts. It may be that it takes time for some contacts to come forward. I'm not saying that's the case in this situation. So speed is of the essence, but there will be different characteristics and different outbreaks that will determine the complexity of that. I can't comment any more on the specific cases because I don't know the specific details concerned.
I call John Mason to be followed by Jackson Carlaw.
Thank you very much. I think the First Minister knows that churches and other places of worship have been keen to follow the guidelines, but are also keen to reduce social distancing and be able to sing again. Can she clarify when that will happen?
First Minister.
Well, singing, particularly congregational singing, I know is important to faith communities. The guidance for the safe use of places of worship advises that congregational singing can take place from level 1 and for small groups such as a choir or a band only from level 2. At all other levels, 3 to 4, which no part of the country is in at the moment, singing should be avoided because of the heightened risk of transmission. From the 19th of July, assuming that the data supports this, we will be in a position to reduce physical distancing in all indoor settings to 1 metre, and that will include places of worship. And we will continue to engage with and support faith and belief communities as we move forward, so that they, as I know they are all very keen to do, can get all aspects of worship back to normal.
Jackson Carlaw to be followed by Bob Doris.
One welcome success of the pandemic has been the support offered to the First Minister by signers. And on behalf of the deaf community in my constituency, can I thank them for the really outstanding and sustained job that they have done. But it does belie a much more complicated pathway for the deaf community to public services, and particularly to GP services. Initially, many of them received letters saying they should make telephone appointments, which, of course, I assume was inadvertent. Subsequent online appointments often take place without a signer, and when a signer is provided, they can join the consultation from anywhere in the UK. And sign language, just like any other language, has nuances, which mean that many in the deaf community are concerned that very delicate matters relating to their health aren't being properly translated. What they are looking, hopefully, to have again is the right to direct face-to-face contact with GP services. And they're looking for the First Minister to champion that so that they can have that right again at the earliest opportunity. Many have put off seeking a GP for far too long. Will the First Minister seek to intervene to allow that to take place?
First Minister.
Well, as I have done before, and as no doubt I will in the future, I want to thank the signers who have worked so hard and so well to help people access the Scottish Government's public health messages over the course of this pandemic. There has been criticism, I think justified criticism, that the same provision hasn't been made with number 10 press conferences, and perhaps that's something Jackson Carlaw might want to champion himself on behalf of the deaf community, because it's the deaf community, amongst others, that have made that criticism. The comments about the difficulties that many in the deaf community have in accessing services, particularly through the pandemic, is a legitimate one. As we get services back to normal, that will alleviate, although services right now should be catering for that. GPs should be, I think I responded to a question last week on this, GPs should be offering face-to-face appointments already where that is appropriate, but as we go through or down the path that I have set out today, when physical distancing is reduced, hopefully removed altogether, and as more restrictions are eased, then we will see, and the Scottish Government will certainly be championing this, a much greater return to face-to-face services.
Bob Doris to be followed by Colin Smith.
Presiding Officer, I welcome the continued positive rollout of the COVID-19 vaccinations in Scotland, but we must not be complacent. Australia, for instance, is highly successful in managing the initial spread of coronavirus, but has experienced a series of small outbreaks in recent months. These are related to the slow rollout of the vaccine and vaccine hesitancy. Does the First Minister agree this highlights the absolute importance for as many people in Scotland to take up the vaccine when offered their appointment, not just for the safety and protection of themselves and others, but of course given there is now a clear link between vaccine uptake and Scotland continuing to ease restrictions?
First Minister.
I couldn't agree with that more, and I'm sure everybody across the chamber does. I would appeal to everybody, as I do almost every day, to get vaccinated when you are invited to an appointment, and particularly to get the second dose. We know that the first dose of vaccine gives some protection, but it is the second dose that gives significant protection, and that includes protection against the Delta variant. So please turn up for the vaccine. The more people that are fully vaccinated, the more this link between cases, hospitalisations, serious illness and death will weaken to the point, hopefully, of almost breaking that link completely. But every person that is not vaccinated is somebody who is still vulnerable to the virus. So, as a way of protecting yourself, but also as part of that collective civic duty we owe to each other, please come forward for the vaccine. We've seen extraordinarily high uptake so far. They are not as high in the younger groups as they are in the older and frailer groups, but still high by comparison to other vaccination programmes. But I think every single one of us can really play a part in encouraging everybody we know to get vaccinated and to make sure you get double vaccinated. It is absolutely the way out of this for all of us.
Colin Smith, to be followed by Joe Fitzpatrick.
Thank you, President Officer. The First Minister referred to the importance of the clinical advice on an 8-week period between first and second vaccine doses, but we are seeing an increase in number of errors in letters inviting people for vaccinations. For example, in Dumfries and Galloway, some 800 children were invited for vaccination who are too young, and we know that thousands of people in Glasgow have recently been invited for a second dose less than 8 weeks from their first dose. So can I ask the First Minister if any review into these errors will cover all health boards to make sure that as we move forward towards potentially, for example, having booster jabs, that procedures are tightened up to avoid future errors?
First Minister.
All of these administrative glitches that happen in the system are quickly identified and quickly rectified. We don't want to see these happen, and lessons are learned from all of them. But I also think, not least for the sake of those who are working round the clock to deliver this vaccination programme, that it is important to put it in context as well. This is the biggest ever population vaccination programme that this country has delivered. It is going exceptionally well, and the administrative glitches that are mentioned are tiny in the context of that. They're not unimportant, but let's not take away from how well this vaccination programme is going. It is running smoothly, it is accessible. We will learn all lessons as we go into potentially a booster period in the autumn and potentially into a further round of it next year or the year after that. But I want to pay tribute to everybody who is running the vaccination programme. I got my own second dose yesterday at the NHS Louisa Jordan. It was running like clockwork, and all of the people delivering this programme deserve our grateful thanks.
Joe Fitzpatrick, to be followed by Jeremy Balfour.
Thank you, Presiding Officer. Presiding Officer, local businesses and charities in Dundee have been in touch to ask about bulk ordering of lateral flow devices to help support their efforts to drive down case numbers in the city. Can the First Minister advise what opportunities there are for such organisations to obtain bulk orders of lateral flow devices to help support our COVID recovery?
First Minister.
Well, in the event of an outbreak, local authorities and health boards have a very broad range of testing interventions that are available to them that they can and many are deploying quickly. Businesses who have been identified as high risk or who have been nominated by local health board leads are also considered for inclusion in workplace testing. At the start of June, we wrote to local health boards to invite nominations for businesses that could be considered for targeted testing. That's at the discretion of health boards. They need to use their local judgment and engagement with local authorities and decide which businesses they think will most benefit from that. In addition to that, of course, lateral flow testing is universally accessible to anyone. They can collect test kits from test sites or pharmacies, order online for home delivery. We will keep all aspects of the testing policy under review, but there is no need not to have access, whether you're a business or an individual, for lateral flow testing at the moment, because they are widely accessible and on a universal basis.
I call Jeremy Balfour to be followed by Rona Mackay.
Thank you, Deputy Presiding Officer. Can I welcome the statement from the First Minister, particularly for the festivals and fringe starting in Edinburgh in a couple of months' time. But can she confirm that all cultural venues, whether standing or seated, will be come under a 1 metre rule, and for any venue that is outside, there will be no restrictions at all? In regard to looking forward, is she confident that theatres and cinemas will be able to have no restrictions come the autumn so that they can plan for productions taking place?
First Minister.
Well, I'll insert the caveat that I have throughout my remarks today. This is all dependent on meeting those milestones that we've set out, both in vaccination and meeting that strategic aim of keeping cases at a level that allows us to alleviate the harms. But if that is the case, then I hope that by the 19th of July, physical distancing, the legal requirement for physical distancing outdoors will be removed, and indoors in premises, and this would include premises mentioned that don't already have a 1 metre dispensation, that the requirement will reduce from 2 metres to 1 metre. If the data allows it, and again I'm going to keep stressing that if, then by the 9th of August it would be our intention to remove the legal requirement for physical distancing indoors and outdoors completely. As I said, we may still advise people to take care around safe distances, but we want to bring the legal requirement to an end as soon as it is safe to do so. We're setting out those expectations today in order that businesses, including those in the culture sector, can start to plan along those lines. And of course, we will keep people as updated as possible as we review the data on an ongoing basis in the weeks ahead.
There's still a great deal of interest in asking a question of the First Minister, and I'd be grateful if colleagues could pick up the pace wherever possible. And I call Rona Mackay to be followed by Jackie Dunbar.
Thank you, Presiding Officer. Last week I met with my constituent Kevin McPhillips regarding his soft play business in my constituency. He's concerned that while competitors in Level 1 can reopen, his business is without income. Can the First Minister outline what supports are available for soft play centres in Strathkelvin and Bearsden, and whether the Scottish Government is re-examining their position within the protection levels?
First Minister.
Well, I don't underestimate at all the significant impact that the pandemic has had on soft play centres. Indeed, in recognition of this, the Finance Secretary announced additional funding for the 14 local authority areas, which includes East Dunbartonshire, that have remained for now in Level 2. This includes £100,000 for soft play centres, which remain closed, and they receive funding on a weekly basis. We keep plans under review and will, as I've said today, accelerate the lifting of restrictions if possible, but hopefully what we have set out today about the move to Level 0 for the whole country will also be positive for the soft play sector. Of course, the funding I've spoken about is in addition to rates relief, funding through the contingency fund and closure grants as well. But we will continue to do everything we can to get to a position as quickly as possible where soft play centres are able to open again.
I call Jackie Dunbar to be followed by Sharon Dowie.
Thank you, Presiding Officer. While recognising that any
Okay, I call Sharon Dowie at the moment.
Officer, hopefully I won't freeze. For over a year now, patients the length and breadth of Scotland, many of them vulnerable and elderly, have been suffering from chronic foot pain. Podiatry treatment used to be handled by the NHS, but since COVID, GPs have turned patients away, sending them to the private sector instead, where bills for simple procedures can stretch into hundreds of pounds. After a tough financial year, patients have had to make a choice, either pay for the private medical treatment or endure chronic pain, lack of mobility and all the associated strains on their mental and physical health. Many have been forced to choose the latter option, consigned indoors while the rest of Scotland enjoys newly found freedoms. With NHS workers and our vulnerable groups now having had both jabs, and with all of us placing so much importance in staying active, why are the treatments still not available on the NHS, and when will these urgently needed services resume?
First Minister.
Podiatry services, indeed like all health services that people have a requirement for, should be available on the NHS. It is an important issue. Podiatry services often for people, as the member has reflected there, will make the difference between being able to get out and about and be active and not. I'll ask the Health Secretary to write in more detail about specific plans and work underway to get podiatry services and other services back on track as quickly as possible.
I call Christine Graham to be followed by Daniel Johnson.
Thank you very much, Presiding Officer. Free lateral flow home test kits can be made available online. I note that, but not everybody is online. The statement says these can be collected from community pharmacies, but I had a constituent who was unable to do that. Is it practicable, First Minister, to provide a list of community pharmacies where you can uplift these for yourself and not have to go online?
First Minister.
Well, I think more than 90% of the community pharmacy network have opted in to provide this service. Not absolutely every community pharmacy will be able to do so, but as I say, I think 93% have. Since the community pharmacy service launched at the start of June, I think over 18,000 free home test kits have been collected from over 1,100 community pharmacies, and at least 87% of the population are within a 30-minute walk of a pharmacy collection point. Obviously, in urban areas, that will be much, much shorter. So we will continue to work to try to open access and make access as flexible as we possibly can. But I do think the system and the service that community pharmacies are now providing has been a step change in making these test kits accessible to people right across the country.
Daniel Johnson to be followed by Stuart McMillan.
Thank you, Presiding Officer. A number of constituents have been in touch with me who, while looking forward to starting their university careers this autumn, are concerned because they won't turn 18 until after September and therefore are not eligible for their first vaccination until after that point. I understand the importance of JCVI guidance, but is this not a situation where there needs to be flexibility at the margins of that guidance? So will the First Minister look at ensuring or finding a way for people who have not yet turned 18 to receive their vaccinations before they start university in the autumn?
First Minister.
No government in the history of devolution has done anything other than base its decisions on vaccination and immunisation on the advice that comes from the JCVI. I think, although I'll be corrected if I'm wrong in any way here, although this is not the case in Scotland, I think in England and Wales it's a statutory requirement to do so. I spent many years, as members know, as Health Secretary. One of the most difficult things, I think, to be asked to do, and I think one of the things any politician should resist doing, is interfering with that advice when it comes to who to vaccinate. So I understand the point that's been made. We are eagerly awaiting the advice of the JCVI and will act upon that advice. Obviously, there's been some speculation in the media about what direction that advice might go in, but it is likely, of course, that the vaccination programme will not be a one-off, that it will continue. So regardless of what the JCVI advice is right now in terms of younger age groups, those at the margins are likely to be vaccinated in a future programme anyway, even if the advice is not to lower the age recommendation. I understand all of these points. I understand the reasons why these calls are made, but it is such an important principle that we follow clinical advice on vaccination, given the need to maintain public confidence and some of the sensitivities and concerns that people have around these issues.
Stuart McMillan to be followed by Tess White.
Thank you very much, Presiding Officer. Presiding Officer, whilst the vaccination programme is going well, and we know there is the likelihood that booster vaccinations will be required, can the First Minister give an indication as to when she expects to receive guidance about this from the JCVI?
First Minister.
We are expecting to receive JCVI guidance on this point over the next few weeks. I don't know exactly when that is likely to be. I very much hope it will be sooner within those few weeks rather than later. I know all UK governments are in that position. Obviously, those who were vaccinated at the earliest stage of this vaccination programme got their first dose of the vaccine in December in a small number of cases and in January. So it may well be that a booster campaign is needed through the autumn. We are making sure that we are planning for that right now, so that whatever the advice is, if the advice is to do booster vaccinations in the autumn, we are ready to get going with that as soon as possible. But we hope to get the advice within the next few weeks.
And Tess White.
Thank you, Presiding Officer. Regarding the bill, external groups such as Amnesty International and Inclusion Scotland have expressed concern that this timetable means that there has been no time for consultation on plans to extend extraordinary powers for ministers for up to another year. Given that these powers don't expire until the end of September, why is this bill being rushed through in the next 3 days with no consultation and limited parliamentary scrutiny?
First Minister.
I wasn't in the chamber, Presiding Officer, but I do understand the Parliament has just had a vote on that matter. And members of the Conservative Party rightly had the opportunity to make their views known. This is always a difficult balance. I don't want to have to take emergency legislation through the Parliament if it can be avoided. I don't want to have emergency powers in place. In fact, this legislation will allow some emergency powers to expire because we don't think they are necessary anymore. But given that this Parliament is about to go into recess for 2 months, and given that we are still facing a much more hopeful prospectus in terms of COVID because of the vaccines, we're still facing an uncertain period ahead. I think it is prudent that with the debate and deliberation that will take place today, tomorrow and Thursday in this Parliament, that we have those contingent powers there should they be necessary. But they are only used if they are absolutely necessary, and Parliament has the opportunity to scrutinise them over the next 3 days.
That concludes the First Minister's statement COVID-19 update. My apologies to those members I was unable to take. There will be a short suspension while we move on to the next item of business.